Hi, I'm Christopher Westfall. I'm a licensed Medicare agent. Today I'm going to explain and take our time going through this to make sure it's simplified. How do excess charges work with Medicare? It seems like it could be overwhelming. It seems like it could be something scary, but I assure you it's not. And at the very end of this video, I'm going to show you how to compare whether or not your physician is or is not participating in Medicare, and there's probably no excess charge exposure to you at all. So stick around. Also, if you want to check out what we have going on Medicare videos about how Medicare pertains to you, the good, the bad, the ugly, and how to use it, make sure to subscribe to our channel. So the question, how do excess charges work with Medicare? There are three different types of providers. There are participating providers with Medicare, non-participating providers, and then there's private contract providers. We're going to look at each of them real quick, I assure you. So participating doctors, this is the vast majority, and again I'll show you in just a minute how to find out if yours are participating in Medicare. These folks are paid 100% of the regular Medicare fee schedule. It's a reward for being a participant in Medicare. They will file all your claims for you. Medicare is then going to pay automatically the 80% of that Medicare allowed charge. Then you, the patient, are responsible for 20%. That's why we help people with Medicare Supplement or Medigap plans, which pay this 20% for you. The trick is there's no limit. There's no maximum out of pocket on the 20% that you could be exposed to. That's why we help people with Medicare Supplements, and our service is no charge at all. So assuming you don't have a Medicare Supplement, you would then pay the 20% remaining after Medicare pays the 80%. That's after you pay your once per year Part B deductible of Medicare, which as of 2019 is just $185. You pay the $185 first, then you're doing this 80-20 dance with Medicare for the rest of the year. Unless you have a supplement, then the supplement's going to pay that 20% for you. And with participating doctors, they accept what's called Medicare assignment. Medicare assignment means whatever Medicare is going to pay them, that's what they agree to take. There's no issue whatsoever with balance billing or excess charges or anything like that. And as you will see, the vast majority of doctors accept Medicare assignment, so that's not a big deal at all. So there are no excess charges. Then the second type of provider is non-participating. All that means is they don't necessarily accept Medicare assignment as payment in full. These doctors still participate in Medicare, but they're not accepting Medicare assignment as payment in full. And you can clearly find that out before you go to these doctors. This is a very, very, very small amount of doctors, as you'll see in just a minute. So these doctors are paid on in the 95th percentile of the Medicare claim. Remember I said that full participating doctors get 100% of the Medicare allowed charge. These non-participating, they don't accept assignment. They start at 95% of the full charge. And then Medicare pays its 80%, and then you, the patient, would pay the other 20%. Unless you have a Medigap plan or a Medicare Supplement, then that's going to take care of that for you. These doctors can, they don't all, but they could charge up to 15% as an excess charge, but that's only half the story. So also in other certain states, there are what they call the Medicare overcharge measure rules in effect. And what this means is if you live in the states listed here, Connecticut, Massachusetts, New York, Ohio, Pennsylvania, Rhode Island, or Vermont, the state law specifically forbids any provider from charging in excess of what Medicare will reimburse. So again, if they participate, Medicare says these providers will be paid at the 100th percentile, 100% of the Medicare allowed charge. If they don't participate, the starting number is 95%. That's the key. Remember, 95% is where they start. So how does that exactly work? Here's how it works. Assuming you're not in one of those states that forbids Medicare excess charges, let's take an example of a $100 claim. You go to the doctor's office, the bill is going to be $100. Well, for a non-participating doctor, the max they can get from Medicare is going to be based on 95% because, again, they opted to not participate in full Medicare and Medicare assignment. So the doctor now starts at $95. They could charge an extra 15%, not an extra 15% of the whole bill, an extra 15% of their allowed $95. So how does that work? Medicare is going to pay 80% of that. Here's how those numbers work. Let's say it's a $100 bill. Would have been a $100 bill if they did participate. They don't, so it's going to be $95. Of that $95, they want to charge 15% more, 15% of $95 more. So Medicare is going to pay $76. The patient's responsibility right off the bat is the 20%, which would be $19. And then we look at the 15%. But remember, this is the key. It's 15% of the lower amount. So in this case, you'd only have a balance bill of $14.25, and that's a worst case scenario. Now remember, if you have Medicare Supplement Plan F or Plan G, they include excess charge payments for you. If you have Medicare Supplement Plan N, you could potentially have to pay an additional only at the doctors who don't participate. That's a very key word right there. So this is right from Medicare.gov, and the language is very important. It says, here's what happens if your doctor does not accept Medicare assignment. You may have to pay the entire charge at the time of service. So if the doctor does not accept Medicare assignment as payment in full, and you really shouldn't go to these doctors if you don't have to, and I'm going to show you how you can find out here in a second. Your doctor or provider is supposed to file the claim to Medicare anyway for you, even if they don't accept full Medicare assignment. Sometimes they don't. And in that case, you can simply download the form or call Medicare and they'll help you with that, and the doctor's office will help you as well. But the doctor's office is not allowed to charge you for filling out that form. So the limiting charge down here, the provider can only charge you up to 15% over the amount that non-participating providers are paid. Non-participating providers are paid at 95% of the fee schedule. So, limiting charge only applies to certain Medicare-covered services and does not apply to supplies or durable medical equipment, because those are under Part B, but cannot apply to any excess charges. So here's a really awesome figure I really want you to pay attention to. This is from the Kaiser Family Foundation that constantly does cutting-edge research on how Medicare affects people, healthcare in general. And what they found is, here's the title, Balance Billing in Medicare has declined significantly. Almost all physician services are now paid on assignment. Look at this number here. This has been improving, but as of this number, 99% are paid on assignment of all physician services are paid on assignment. What does that mean? It means all you have to do is look out for that 1%. It's 1% of the time that you have to worry about it on an excess charge. And if you live in those other states where it's illegal, you don't have to worry about that. Now, who participates in Medicare? Looking at all providers, who participates in Medicare assignment or not, 96%, according to the study, participate in accepting Medicare assignment. You can look at the study down there. There's the address. I'll link it in the video below. And here's the funny thing about it. Of the doctors that completely opt out of Medicare, and that is their concierge doctors, they want nothing to do with Medicare, they just want to accept cash only in many cases, or a certain fee per year per patient, it's only 1% of providers that are not accepting Medicare at all. That's great news. And of those doctors, 42% of that tiny number are psychiatrists, and they just want to bill patients straight to the patients. Now, if they had employer insurance, under 65 major medical type insurance, they accept those typically, but they don't participate in Medicare at all. A whopping 1% of providers, a big portion of them are psychiatrists, sorry. So, how do you know if your doctor participates in Medicare and accepts Medicare assignment? That's the key. That's the gold standard. You want your doctor to accept Medicare assignment so there's no claim forms, no fuss, no muss, no excess charges whatsoever. All you're bound by is your Medicare Supplement policy. There's a real easy way to check this. Now, if I could explain it any better than they did, I would have. But I can't. They've done a really fantastic job at Medicare. You can look at the service at Medicare.gov, and you should not get it from anybody else's websites, no matter how pretty and clean their websites are. Go to the source, Medicare.gov. Make sure it says Medicare.gov in your address bar on your computer screen. And you just go down to where it says Find Doctors, Providers, Hospitals, Plans. And there you will see who participates and who does not participate in Medicare. I'm going to show you the video now from the folks at Medicare on the really neat things, including how your doctor is performing with safe standards. Right now, you can look up your doctor, see if they participate, see if they accept Medicare assignments, so you don't have to worry about it at all. I assure you, your doctor probably will, and you can see how they're doing with the measures that Medicare is trying to put in place to keep doctors accountable. It's a great system. Here's the video straight from Medicare. By the way, before I go, make sure to subscribe to this channel so that you can keep up on Medicare updates and how to use Medicare best for you. And if you need our help for a Medicare Supplement policy, which you can change anytime during the year, a lot of people keep their plans too long, and we've not shopped that plan for you, so give us a call so we can shop that plan. You can literally change or start a Medicare Supplement policy anytime during the year. There is no time frame. Our phone number is right up there. Yep, right up there. Give us a call. Here's the video to watch on the Medicare Physician tool, and you're going to love it. Take care. Bye-bye.
All physicians and other clinicians listed on Physician Compare take part in Medicare. And there are 3 different ways to find the information you need. Let's take a look at how Linda, Mary, and Don use the Physician Compare website to select their doctors. Linda is a Medicare patient looking for a new primary care physician in her area. She lives in Crest Hill, Illinois. The location box automatically recognized the location of her computer, and Crest Hill, Illinois is filled in for her. Linda enters primary care physician into the main search bar. The drop-down box gives a few options for what she may be searching for. She makes a choice from the drop-down box based on her needs. Here's the results page of physicians who practice internal medicine in Linda's area. Physicians are listed on the left of the page in order of distance from Linda's location. She can pick from either a group or an individual clinician. The map on the right has pins to show practice locations. Linda's current location is shown with a blue pin. Linda can use the filters across the top of the screen to refine this list of physicians based on distance, Medicare-approved payment amount, gender, and more. She can use the Add to Compare button on a listing to compare as many as 3 different physicians or 3 different groups. These 2 icons indicate that this physician accepts the Medicare-approved payment amount and has performance information available to view. Performance information shows whether the doctor provided patients the recommended care. Now let's see how Mary uses Physician Compare. Mary's current neurologist wants her to get a second opinion for her constant migraines. Mary and her caregiver, Nancy, visit the Physician Compare website and begin their search for a clinician. They find the Search by Body Part button. Mary clicks on the diagram of a woman's body. They can pick the area of the body they're concerned about. Mary chooses Head from the list of available body parts on the right and then selects the Next button. She then selects Headache/migraine from the list of health topics. She selects Neurology from the list of specialties. Mary is redirected to the results page. She and Nancy select a group from the list. Nancy has a friend who told her she got great care there. They read about Medicare-approved payment amounts, affiliated clinicians, and performance information, and decide this group would be a good fit for her. Finally, let's see how Don uses Physician Compare. Don's primary care physician wants him to see a cardiologist for some chest pain he's been having recently. He's having difficulty spelling cardiologist, but then he sees the Browse by Specialty button. Don selects the letter C at the top of the page, and it automatically takes him to all specialties beginning with the letter C. As he goes to pick cardiology, he sees that when he hovers over each term, a definition appears to explain what the specialty is. Don selects cardiology and is redirected to the results page, where he sees a list of available cardiologists in his area. He chooses a group. He notices that this group accepts Medicare-approved payment amounts and has performance information available. Don also sees that this group has patient survey scores. He chooses the tab. These scores are based on information patients reported about their experiences getting care from the group. Based on the feedback, Don decides this would be a good group for him to visit. He's glad this website was able to provide him with vital information so he could make an informed decision to improve his health. Quality health care is important for everyone. The Physician Compare website is one of many ways CMS is working to help you make informed decisions about your health care. Explore the resources available to you on Physician Compare today.